Hello, and welcome by my presentation for the Kosovo pharmacists. I'm very glad that we can do it this way in this strange time period of life. We would come very gladly to your country in March, but I believe it was 3 days before we would travel, then Corona set a stop to everything. But in these difficult times, I also want to help you to show you the possibilities of the pharmacists in general, and of course we talk about diabetes in very specific. So let me introduce first myself. I'm a university teacher for pharmacy students. I developed a pharmacy chain in the Netherlands, almost 350 pharmacies. I'm the founder and owner of the Uptake Totaal group. That's for the Dutch pharmacists. I give all kind of trainings in pharmacies for pharmacists, all different things. I'm also the founder and co-owner of the World Pharmacy Support Group. That's more the international part. I wrote many books about pharmaceutical care and all those things. I have ebooks, and I'm international advisor. China, Mongolia, Suriname, many more different countries. I can honestly say I trained more than 1,500 pharmacies and 5,000 pharmacists, and I think it's more, but it's not really important. So then you know a little bit of my background. I'm not a pharmacist. I'm a psychologist. I'm an economical. I studied economics, and I always worked in the world of pharmacy. So a little about my other part, that's the International Pharmacy Support Group. We are the first organization that's approved by the FIP. We work together with them to help many countries to improve the quality of their work. We develop videos and training programs about pharmaceutical care. If you like it, you can watch this on the website. On the left, you see our headquarters. So if you come to visit the Netherlands, we can invite you over there. But what we mainly do is help pharmacists step by step to go to a higher level. And that's one of maybe hobby, yes, but I like to do that. So first, 1 minute, a little introduction about the Netherlands. I know Kosovo is also a new country and a young country, but the Netherlands is a very old country, but was always and is a very small country. But we are always a little proud of the things we achieved. If people talk about the Netherlands, they think about the cows and the wooden shoes. No, it's only for tourists. You almost never see somebody walking on wooden shoes. The tulips, of course, beautiful, but only in April and May. The famous painters, we have Rembrandt, we have Mondrian, we have Van Gogh, you can name them. The windmills, always nice. Amsterdam, no, you get the picture. So let me first talk about how we in the Netherlands organize the pharmacy. We have a population around 17 million people, and a study for pharmacy takes around 6 years. We have 2,000 community pharmacies and 300 hospital pharmacies. 300 hospitals, and they have a pharmacy for the patients. We have also 40 hospitals, 40 of the 300, who has a polyclinic pharmacy. That is for the outgoing patients. They get, most of the time, specialized medication, and then they get a specialized advice from the polyclinical pharmacy. The average pharmacy has 2 pharmacists and 8 assistants, technicians. And annual revenue is around 2 million for every pharmacy. The annual cost for pharmaceutical care is around 4 billion euro, and average cost of medication is around 250. So that you have an image. For your knowing, it's interesting. The Netherlands is one of the few countries who has special shops for OTC. Every Dutch pharmacy, as you can see on the picture, they have and sell OTC, but only most of the time the most necessary OTC, for example, to help for a side effect of medication. The avenue of the OTC is around 5% of their total income. So 95% of their income is earned by helping the patients to get the medication correctly, and they get paid by the insurance company for that. If you're interested, I can also talk about how you can sell more OTC, because there are interesting steps to do that. A pharmacy.
Ja, maar omdat dat bij iedereen anders is wat er gekoopt werd, kennen we die niet in een pakketje. Wilt je er 1 of 2 trucjes van? Ja. Ik schrijf een keer de verzekering dat het... Mag ik dat ook afgebouwd? Oh ja.
So you see here, very simple, an advice of a technician about the use of the medication. So when the prescriber prescribes medication, the technician take a look in the computer if it's possible to deliver this medication, if there's no interaction with other medication, for example. Then they prepare the medication, and within half hour, the patient comes to the pharmacy and then collect the medication. If it's for chronic patients, we have a system that every 3 months they can collect their medication, and that we know when this time when the moment there is that the 3 months have passed, so they can already in advance prepare the medication. So let's talk about the pharmacy. What is the task of a pharmacist? And I really hope that you not say it's delivering the medication, because that's a thing that Amazon and Alibaba or whatever big parties can do also. Delivering a package from one door to another door is not interesting. So in my opinion, are the goals of a pharmacist to increase the quality of life of patients and to prevent unnecessary hospitalizations, avoid unnecessary death, mortality, saving healthcare costs, and the thing only a few countries do very well is increase the awareness of the role of the pharmacist in the healthcare part. Because many people, many prescribers see the pharmacist as just delivering the box. So I can give you one example of how important it is to make sure that the role of the pharmacist is bigger than people know. If I ask at international congresses, when I speak for prescribers, specialists and doctors, I ask them, what is the role of the pharmacist? They only come with one answer: delivering the medication. So then I ask them, what do you do if a patient comes and he has a normal disease and you prescribe a medication that normally works? After 1 week, this patient comes back to the prescriber and says, I'm still sick. What do you do as a prescriber? And I'm always a little scared by the answer of 99.9% of all prescribers all over the world. They go over to plan B. They think, oh, plan A didn't work, so we start with plan B. They never ask, did you collect the medication? Did you use the medication? Did you use the medication correctly? They think, when I prescribe, then this will work. So this is one of the things you can make sure that your role is really important. But the outside world need to know this. And increase quality of life of patients. When somebody stays home because he's afraid to go out because of the medication they use, then maybe you can help them. You can tell them, if you take this in the evening, then etc. Or it's really no problem, you can do it like this. I can give you a very beautiful example. There was two elderly people, around 80 years, and they had, for one part, the same medication. The technician told them, for the first time, okay, when you take this, you can get a little dizzy, so it's important that you take the medication when you sit. Best stay home, take the medication, wait 10 minutes, and then there is no problem. That can take a few days. This last part, that can take a few days, they didn't understand. They just understood we have to stay home at 4 o'clock in the afternoon. We have to take the medication, we have to sit, we have to wait. So after 1 year, when the technician asked, how are you doing? Is everything okay? Oh yeah, no problem, no problem. We always stay at home at 4 o'clock, we sit, etc., etc. So then the technician here, wow, you are making a mistake. She didn't tell this like a mistake. She was very political correct. She said, all right, have you been dizzy for the last few weeks? No. Okay, then we now can establish that the medication is working correctly. You don't need to stay home. You don't need to sit when you take the medication. You only need to take them around 4 o'clock. And the two elderly people were very happy. Oh, that's nice. Then we can go in the afternoon. Such a simple example, but so important. I will talk about the unnecessary hospitalization further on. So these are the main goals of pharmacy. And the question is, are you aware of this? Is your team aware of this? Or is it just a logistic operation of getting all the medication to the patient? And that's quite different, because I can assure you that big companies are telling we can deliver the medication also. What is happening now? 2 months ago in India, 1.23 billion people. Amazon said, due to COVID, we can make sure that we deliver the medication so you don't need to travel, and because that's dangerous because of COVID, you can stay home. We deliver the medication. That's not about COVID. They are already looking for many years for every possibility to get some more money for another new product. Delivering medication, very interesting. So you need to be aware that big companies are looking for possibilities to see how can we earn some money. And if the insurance company or the government isn't sure about your function, is it only delivering, then they will look at the costs of delivering. And if a big company says, well, I can do it cheaper, why not? So this part, if we talk about diabetes later on, is not only about diabetes patients, but it's also about the role of the pharmacy. Okay, I hope I keep your attention. So the values, the core values of a pharmacist is the commitment of the patient's well-being. In China, we talk about you're the lawyer of the patient. The pharmacist is the lawyer of the patient. We think with you what is the best. So that's interesting. So you need a pharmaceutical expertise. You need knowledge. And with this knowledge, you can advise better. You have also social responsibility. Sometimes you will see things where you think that's not correct. In the Netherlands, there are examples of people who died, and then the doctor came at the last day, and they see all the medication, but not used. And when people come for a refill of their prescription, sometimes you can see something is not correct. But how do you do this? How can you talk about this? It's really, really important. Of course, you need to be reliable and careful. And there is a professional autonomy, and that means that only you can do this. This is not a very simple thing. In the Netherlands, after many, many years, a pharmacist is now equal to the prescriber. They are both equal responsible for the patient. Really interesting. So let me give you an example. The core value of your work. This man is getting a heart attack, not good. So we need to go quick to the hospital. That are costs. Specialists perform open heart surgery. This was necessary, okay. Very expensive cost. But afterwards, a few days, maybe a week, they take good care of you after the operation. Costs. Then I go to the pharmacy because I get medication for the rest of my life. And if this is a good pharmacist, they provide the necessary medication and the necessary information. But what happened when I'm home and I don't use the medication? And this is really interesting. What are the costs of the operation? What are the costs of the transport? What are the costs of the days in the hospital? All these things are worthless if the patient don't use the medication correctly. And I can tell you, only for heart patients, I give you 2 examples what really grind my gears. That's in Belgium. I heard a specialist tell in an interview, he said, we can decrease, so lower, the mortality of heart patients after operation with 50% if they only would listen to our advice. You have to walk more, drink less, etc. They were not saying what we tell is not coming inside the heads of our patients. We need to change our information or whatever. They just say, we tell them how to do it, they don't do it, not our responsibility. In the Netherlands, the mortality of the heart patients is 3 times higher than the mortality of all fatal car accidents in 1 year. So we know a lot of people don't use the medication correctly or don't use it good, but we don't see this as a problem. We give the medication, we tell you that 3 times a day, in the morning, afternoon, evening. We don't control, we don't ask, are there any problems? So there are so many challenges in the pharmacy for things that we can do better. So let's do this step by step. First of all, this is really important to understand. By chronic patients, the therapy is often low. And that means that, sorry, the picture is not good, but by prescribed 100%, then international, already 12% of the people who get a prescription of medication don't collect the medication. They say, thank you, but they don't do it. They are afraid, they think about costs, they are stupid, whatever reason there is. So 12% already, they need medication, but they don't collect it. Then again, from the people who collect the medication, it's 12% who don't use the medication. They collect it, thank you very much, yeah, put it down, not use. And after a year, only 47% of the people use the medication correctly. I've been involved with a lot of medication projects and pharmaceutical care, and the number of mistakes is frightening. The number of mistakes people have in not using the medication correctly is gigantic. So you need to know that your information in the use of the medication or the needles for the diabetic patient is just half of the process. It's not that when you tell them, now they do it correctly. There are all kinds of reasons, sometimes unknown, they don't know this, but they make mistakes, or they do it with conscious. They think, I'm afraid of side effects, or I don't want to, or whatever. So this is really, really important to understand. So, according to the estimate of the World Health Organization, the wastage of this not use of the medication goes into about 290 billion a year. This is an amount of money you cannot imagine. you can use this amount of money in 1 year to increase the quality of life of the half of the population in the world. So for my image is medication is not, that are not costs. The not correct use of medication are the high costs. So only our concordance, the right use of medication, could save in the Netherlands 2.4 billion euros every year. A little example of how people can misuse.
My asthma. They said they'd fix it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes. Anna, you need to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Jerk. What was that all about?
Jamaican chicken recipes.
This, if you like this is a brilliant TV series called Doctor House. But this example, sorry for the music, stop. So this example, sorry, is not made special for this TV series. This is what is happening with a lot of people. I think if you ask your patients, you will find a lot of mistakes that you think, how is it possible? But it's happening. So, see, yeah. So, what are the most important qualities of a pharmacist? And I think this is one of the things you need to understand. It's not only the knowledge, but also the understandable communication. And these two things are really a combination, because knowledge, only knowledge is not enough. Because it doesn't matter if you know everything about the medication, but you cannot communicate, then we have a problem. We all know the problems if you are not a very handy person with computers and you got a nerd who's telling you how to use it. Oh, it's very easy. Can you start here, do this, and don't look this, tick, tick, tick. What? But you are afraid to tell them, I'm sorry, I could not follow. Can we do it again? Okay. How do you start? You just say, and you think, okay, hopefully I find it at home. So if a technician or you telling a patient about the use of medication, they say, oh, it's very easy, you need to use this 3 times a day. 3 times a day. All 3 at once? Or what? For example, I got a little medication after a little operation here, and it was 2 o'clock in the afternoon, and they said, you have to use this 3 times a day. It was 2 o'clock in the afternoon. So I ask, I know the answer, but I want to hear what they tell me. How do I use this today? Do I need to use 3 today? And then you see, good question. These things I'm going to think about when I come home. Okay, 3 times a day, but maybe I have to start tomorrow, or all little things. So it's not interesting if it's for you the 1000th time that you tell something how to use it. For me as a patient, it's the first time. And keep in mind that your knowledge, if you talk too technical, I don't understand. I'm now involved with a very big project, a very good research about how can we make sure that the patient is used the medication 100% correctly. And then we noticed that it has to we have to make a big change in how we give our information to the patient. For example, I like to start with the question, before I give you all the information, what is for you the most important thing to know? What is on your mind when you hear, I now need to use this medication? And then you can get questions about side effects, or what happens if I forget, or can I die, or good questions. Well, let's talk about this first. And then slowly about how do you use them correctly. But what I see is most of the time worldwide, if there is giving advice, I see many countries, it's ready for you, good luck, only distribution, that when they come to the counter, they start talking. So it's ready for you, this is the medication, you need to use it 2 times, 3 times, this, maybe a glass of water, okay, bye-bye. That's not communication. That's not making contact. So the most important quality of a pharmacist, combining the knowledge with understandable communication. So the first step is get the right communication. The right knowledge. What you do today about diabetic patients, diabetic medication, is gathering information. That's good. That increased the quality of your knowledge. But then make sure that the quality stays in your team. For my frustration, I work in this world for around 30 years. I see in the Netherlands, very frustrating, almost every year, every 3 years, the same projects. We're now going to do diabetic. Okay, perfect. All kind of training, these kind of programs, and now everyone's expert in diabetic patients. Next year we do asthma, COPD, and then the third years we do heart failure or whatever. But after 4 years, people ask, can we do diabetic again? Because it's a little disappeared. So what do you do when you're gathering information? How do you make sure the knowledge, if you have a team, then how you make sure that everyone keeps this information at a very acceptable level, and hopefully every year increase the quality of the knowledge. I give you an example. If you have a team with 5, 6 technicians, make 2 persons responsible for this subject and give them 3 assignments. 1, if there's coming a new colleague, make sure in 1-2 months that this colleague also gets the knowledge about diabetic patients. They make sure they get this training, if it's by e-learning, if it's by book, if it's by watching these kind of videos, whatever. These 2 people are making sure that the new colleague also has the new information. 2, if there is coming new information about this subject, by which kind of protocol or publication, whatever, they make sure, oh, this is important that everyone knows. So also they make sure everyone knows this. And 3, most important part, every 6 months, they control the knowledge of their colleagues. We could call this an intern audit, like a quality system. That you say, okay, next week, Tuesday, I need you 10 minutes. I'm going to ask you questions about the diabetic patients, the diabetic medication. Do you have still all the information? And people who feel that the knowledge was a little bit decreasing, they, what was, I look, okay, I study. But every half year, after 2-3 times, okay, now I know. And now I'm going to ask you questions. Yes, but what do we do when people say they want to go on a holiday, and a difficult question? Oh, that's a good question. New knowledge. So we help you with this new knowledge, and we tell the whole team, where we had a good question, here you have some new information. And the interesting part is, if you do this with 2 people who do diabetic, the next 2 people do asthma, COPD, the next 2 people do heart failure, and then the knowledge stays in your organization. And I always say 2 people. If you have a small organization, it's 1 person. But somebody needs to be and stay responsible for this subject. Otherwise, it's a waste of time. I cannot make sure that you are a specialist in diabetic after 1 training. If I go, I'm 60 years old, to a fitness center because I feel my stomach is a little too much, then 3 studies university. After 1.5 good training, I look in the mirror and I hope I see the result. I see, yeah, that's what. No, I know intellectually that's not possible. But emotional, I hope to see after 1 training. But I know that I need to repeat to get results. And that's the main thing of these knowledge things, that if I only get knowledge up, new knowledge, then we know at the bottom it disappears. So you have to make sure that you think about how can I make sure that in 6 months, in 1 year, 1.5 years, this knowledge is still in my team, and for better, it's improving. So that my patients can feel my quality, and maybe even I get famous about this subject because people know for diabetic this is the best pharmacy. And that's interesting. Now, also learn how to communicate so that people understand you. I can tell you communication is a very, very difficult part. I give all kind of trainings for these kind of subjects. So from how do you communicate with patients? How do you make sure they listen to you? How do you make sure they understand you? And one of the most important tips I can give you is not to tell too much, but ask questions. For example, at the end of your information you can ask, but then with a friendly smile, so I want to make sure that I told you everything, so maybe I forgot something, so can you tell me how do you going to use this medication at home? So I can listen that I didn't forget to tell you something. I not say, I want to hear if you listen very well, so tell me, like a school system. No. So you do it friendly. But you need to understand, for this patient it's the first time. For you it's the 100th time. But I don't need to feel that it's, you need and success, bye-bye. So communication, look at yourself. Can you communicate understandable? Because that's half of your work. If you do this, people come back to you. They like your information. I get the feeling you understand me. I had what I told you a few weeks ago here, little operation. I get these kind of things. I get bandage, I get medication. The complete information was 30 seconds. And I was with all kind of injections, okay. But I only thought, okay, I can go home now. Okay, I feel still the how do you say this? I don't know. I forgot the word. No, never mind. But I knew I wanted to go home as fast as possible. And at home, I was feeling the pain. And then I was, what did he say about? But did he mean this or so? I got all kind of questions. But the one thing I didn't do is call him. Because I feel I need to go. The operation is his work. The information is not his work. So it's distribution your work and not the information. I feel that. And then I'm going to Google and I'm going to ask people around me, and then I'm going to read maybe with all kinds of problems. Make sure that you are the person who they come to if they want more information or I didn't understand something. So I want to show you what I worked together with the World Health Organization, what the pharmacists really need to be. And these are the 7 stars. That is a really interesting part. I believe you in a second if you say, I'm a caregiver. I deliver care and I information. But are you also a leader in your organization? Are you a teacher in your organization? Do you want to live lifelong learning? So like congress like this, but keep on learning. Can you manage your organization? Can you communicate? Can you make decisions? So all these things are very, very difficult to put in one person. I know. I teach at the university, as I told you, and I try to tell my students that it's really difficult as a pharmacist, as an exact scientific science, to also be social skills that you need as a manager and as a leader and as a teacher. Complete different skills. And for me, it's not about being perfect. That's the exact scientific part. That's good for pharmaceutical decisions. But organization decisions and talking with patients need to have knowledge which is much more different. So, about this part. If we make this a very simple part, we talk about diabetes. So we need to make sure that I have the knowledge and I have understandable, communication is missing there. So how do we do this? I make sure that the knowledge will be with everyone in my team. How can I do this? I deliver this kind of videos, I deliver information, books, whatever, but I make sure that everyone has the knowledge. Second part is I make sure that the knowledge will stay in my team. So I make 2 persons responsible, maybe I'm self-responsible, whatever, how big your team is. Small team, I do it self, bigger team, I delegate, but I make sure that everyone keep this knowledge. And the third part, and this is really, really important, I want to measure results. I want to know how many patients will I get here for diabetic? How many patients are satisfied with my information? Can I ask the prescriber if they use the medication correctly? Are there any problems with this patient about the use of the medication? How can I measure as much as possible? And if you do so, I can give you a very simple example. You can always ask diabetic, but every chronic patient, are there any questions in the use of medication? I did an experiment in one pharmacy. They had 12,000 patients, the local environment. And what happened, by asking these questions, more than 500 times we could increase the quality of life. People made little mistakes, not really important for their health, but for their social life. Really important. Almost 40 times we found a mistake that would be a hospitalization, for sure. They made a very big mistake, and if we didn't ask these questions, are there any questions, we didn't know this mistake. And later on, I developed a new and extra system because I found out if you ask, are there any questions, that 99% said, no questions. So I said, if people answer with no questions, then ask yourself a question. Every 3 months, different question. Tell them, we are doing a little project. Can I ask you, how do you make sure that you take the medication on the right moment? And then you hear 90% perfect answers. Sometimes little answers, you say, we can increase here the quality. Sorry. So how do you make sure you do it on the right moment? What do you do when you forget to take the medication? Where do you store the medication? You can ask every 3 months a different question and then find out little mistakes. So you increase quality, or maybe you have an hospitalization coming. And, sorry, I need to take a sip of water. But you need to measure these results, because this is so good work, so perfect work as a pharmacist. But nobody knows, only the patient, perfect. So you need to know, you need to communicate with the prescribers about these results. This is what I found out, so the prescriber also learn, oh, I didn't know that they make these mistakes. And please also communicate results wherever you can. Sorry. Long day talking. Maybe local news, medical magazines, pharmaceutical magazines, but communicate the results. And that is increasing the awareness of the pharmacy, so that people know that it's not only delivering the medication, but also doing something good. Sounds very simple. If you use this content, this table, then I really know that you increased quality for the bigger part. So, very simple. I hope you enjoyed my information. I know it is short, but I also know that at the daytime you get all kind of videos and all kind of information. So if you really want more information, you can always contact me at this mail address. I'm sorry, it's a very big mail address. But there you can find my books, my videos. But you can also ask questions if you want, and I always answer them, because I really, really believe in the quality of the pharmacist. But they have to make sure, basic, they have the knowledge and the quality, they know how to use this quality, and they know how to communicate this quality. We always want to help you. So if there are questions, if you think we want more about this, about which subject you want, contact me. Me and one of my partners will contact you, and then we can see what we can do. For now, I really hope that my English was good enough for you. And thank you for your time, and I hope you have a beautiful day today with all this information. Thank you. Goodbye.